If you have seen any of the call to action shows within the last year, then our guest today is no stranger. As a matter of fact, she's no stranger even if you have not seen her on a call to action show, which I strongly suggest that you go to Alex Habersham YouTube and watch the other shows because we have delved into one of the most important subjects and phenomenon of today's society, which is the pandemic, COVID-19. And then when we first began, I guess it probably was close to 2 years ago, Dr. Walker, when we first started talking about COVID-19, the Delta variant, not realizing that we were just warming up as it relates to this pandemic because, it's kind of like a cold that won't go away, though it's not a cold. It's a lot more serious than a cold. But in view of, and I keep wanting to call it, Dr. Walker, the Omicron, but it's Omicron, Omicron. I don't know why I want to put that nid in there, but I was corrected by my darling wife last week when I called it the wrong thing. But from a serious perspective, it's kind of, it seems like, it's confusing, not as it relates to the existence, but well, some people doubt that it even exists. A lot of people who won't get vaccinated, unfortunately, think it's the whim of somebody's imagination, which we know that it isn't. So what I thought would be proper and meaningful and educational and informative if I would have Dr. Patrice Walker back, who is the Chief Medical Officer for Atrium Navigant, to do a follow-up discussion. Like I said, we've had several, but it has not gone away. And both she and I, feel like it's very, very important that the community is informed on the wherewithal, if you please, of everything that's connected with it. So I'm proud today to have Dr. Walker, as I said, the Chief Medical Officer for Atrium Navigant, back to have a follow-up discussion. And I tell you why I keep having these discussions, because both she and I want to motivate people to do what they need to do so we can get back. I don't want the new normal. I want the old normal. That is without wearing masks and being able to go to happy hour and being able to go to church and being able to go to concerts and being able to have relatives over to the house without fear of any kind of contagious disease. So, and that's why we're doing this, y'all, is to try to get, if everybody will, I remember more than a year ago, I know I'm lengthy, Doc, and I'm gonna shut up in a minute, okay? But I remember, 16, 18 months ago, maybe even longer, when we had the scientists, and I say that in all capital letters, the scientists and the medical professionals telling us what needs to be done in order for us to tackle this disease. Well, we're still talking about it because, there has not been the kind of response that we should have as it relates to what should be done. So we want to impart some information on, COVID-19 Delta, but most importantly, we want to talk some about Omicron. How you doing, Doc?
I'm doing well, thank you, and thank you for having me again.
Yes, thank you for coming. So you can begin, just talk about where we are with Delta and the connection, if you would, between Delta and Omicron.
Sure. So hopefully by now everybody, is familiar with the terms Delta and Omicron as they relate to the COVID, COVID-19 or the COVID pandemic. And those two, Delta and Omicron, are what we call variants. So when COVID-19 first came out, it was just it was just itself. It was COVID-19. But what we quickly learned was that there were what we call variants. And those variants were the same. It's all one, it's all one virus, but it's sort of like, we're all one family, but you have different family members, within your family. And so all of these are different family members within this family. We actually had alpha and beta, before we got to Delta, there were some others that we went through those, but Delta seemed to be, in terms of variants, it was the biggest and baddest thing that we knew, really since the beginning. And now we're into the Omicron variant. And one of the things that I want to address is people, understanding why do these variants keep happening? Why do we keep having these different variants? And it's basically the way that viruses work. Every time a virus is allowed to replicate, meaning, and what I mean is go from me to you to the next person to the next person to the next person, the more times it spreads, the more times it has an opportunity to make these little minor tweaks to how it works. And it's still the same virus, but those minor tweaks can sometimes make it have advantages. It can make it spread easily. It can make it, stickier. It can make it less severe. We don't ever know what the next variant is going to do. It all just depends on these mutations, these changes that happen. And then the more it spreads, the more likely you are to get more and more variants. So unfortunately, every time we have a big outbreak, there's a risk that another variant will be formed. And then we have to do tests on that variant to figure out, is it better? Is it worse? Is it the same as what we're dealing with? So basically right now, the Delta variant is, passed on. Let's think of it in that way. It's passed on. It's been overtaken by the Omicron variant across the United States. And in this region in the Southeast, if it hasn't already, it is becoming the predominant variant. Unfortunately, our data lags a little bit because we have to wait for it to get sent into the lab, and then somebody has to put it in a computer. So by the time we have access to the data, it's probably a week or two old. So the data that I have access to is from a couple of weeks ago, showing that the Delta variant, we still had some here, but Omicron was growing more and more. So if I think, now that 2 weeks later, it's probably the dominant variant around here.
Yeah, that's kind of sad, but true. So the Delta is around, and I want to talk about two things. So I want to talk about the potential advantages of being vaccinated against, of course, Delta, and what kind of role does vaccination play in maybe addressing the effects of Omicron?
Absolutely. I want to say first and foremost, and I want to be very clear, I don't want there to be any confusion about it. Vaccination works. Period, point blank, has nothing to do with Omicron or Delta. You are being vaccinated against COVID-19, and the vaccine works. The point of the vaccine was and is to prevent severe illness. What we're seeing again this time is that the vast majority of people that are admitted in the hospital are unvaccinated. If they happen to be vaccinated, they also have multiple comorbidities that affect their immune system, so that their immune system, for a number of reasons, may not, be mounting a good enough response. That's what we saw before, and that's what we're still seeing. And therefore, we are still encouraging people to be vaccinated and to be boosted if it's been more than 6 months since you received your vaccine. What we know about the vaccine is it works, but that over time, the effectiveness of it does go down. okay? And eventually it may completely go away. And so we are going to have to figure out how often a booster is necessary. Right now, we know at least 6 months, and they're still doing research. So it may be something similar to the flu vaccine where you have to get it every year. We don't know, but it's looking like that. Okay, be that as it may, it still works. I know there are those of you out there that either have yourself or know someone that this is their second time getting COVID. We're even having people that this is their third time getting it. But what I have seen over and over is for people that have had COVID and they've either been vaccinated or this is their second time having it, they're having mild symptoms. They might feel a little bad, but they're not the ones that are in the hospital, that are in the ICU. And so that means that the vaccination works.
Well, that's important. I want to kind of interrupt you there because, naysayers and people who promulgate, if you please, negative information are always looking for an angle, to support their negativity. And I think that one of the factors has been that, well, I've known that, AOC, said yesterday that she has it and she's been vaccinated and boosted. So, I mean, I think, and you may want to re-emphasize that, they're missing the point that if you're vaccinated, that doesn't mean that it's totally blocked. That means that the effect of it has been influenced. So would you address that?
That is, you said it perfectly. You said it perfectly. Just because you've been vaccinated doesn't mean you can't get infected at all. There will be some people that will not get infected based off of their vaccination. Other people will get infected, but their symptoms will be mild, okay? Or they may be asymptomatic. They may not even have symptoms, may never feel anything, may never know it, but they could be asymptomatically, passing it on to others. That's possible, okay? So, and which is why we tell people we want everybody to be wearing masks, but we'll get back to that in a second. So, but basically you said it perfectly when you said that just being vaccinated in and of itself does not mean you can't catch it. Chances are you won't, but if you do, you have a mild case.
So let's walk through again the steps that we ought to take in view of the fact that, I'm back, it's here and it seems to be here to stay. In a perfect world, if in fact, the consuming public had heeded those early on remarks about what to do with your 6 feet of distance and your mask and the vaccinations, we probably would have whooped this thing. Because the only way it gets worse is that it continues to spread. So just kind of address that, and then also address, what we need to do moving forward. But what should we do? What are we encouraging people to do? Everybody.
Yeah. Number one is get vaccinated. Get vaccinated. Get vaccinated. That's number one. If you are vaccinated, get a booster. If you have not already received your booster, is number two. And then 3, 4, 5, 6, and 7 really are everything that we've been saying. The foundational, things that we have been saying for people to do. None of that has changed in as far as hand hygiene. No reason to stop doing that. We should all be doing that. We should be wearing a mask when we cannot social distance from people, more than 6 feet. And we should be, lost my train of thought. I'm sorry. Wearing a mask, social distancing, and hand hygiene. That's it, basically. Now, we've been through the holidays. We're getting to the point where we're realizing that we're in a pandemic, and this pandemic it doesn't seem like it's going away, right? It seems like it's turning into an endemic, which is really when we have to learn how to live with a disease
Wow.
state or a, set of circumstances that are just part of, our society, part of our region.
Wow.
And we live with a lot of endemics right now, right? Depending on who you talk to, we have a obesity endemic. We have there are things that are just part of our daily lives, so we take it for granted. And yet it seems like COVID-19 is going to be one of those things that we're going to have to live with it. I mean, flu is endemic at this point. We know that goes through cycles, and flu season comes around, you get your flu shot, and certain things happen, and we shrug our shoulders now because we're used to it. This is just the newest thing on the list, and so we have to get used to what it means. And I know, in the beginning you said, I'm tired of this. I want to go back to the old normal. I don't want the new normal. I don't know if we're going to be able to go back to the old normal. We're going to have to get used to doing things differently. I was at dinner the other night and a friend of mine, and we were talking about how, before 9/11, you used to be able to walk to meet your family member or your loved one all the way to where they came off the plane. I mean, you could just anybody could walk into the airport, and you could go right up to the gate, and you could do that. You can't do that anymore. That was a big difference that we all were kind of like, well, I don't want to do that. I don't want to have to wait for him at the curb. I don't want to have to, but that ended up being our new normal. And now there's a generation of people, children that don't know anything different. They've never been able to walk up to the gate. So, I mean, we need to start thinking like that in terms of this pandemic. For some things are just going to have to be different. It's unfortunate, but that's the way things are going to happen.
Okay, now how about the mask? I went to a meeting today and I asked Coach. Now I've ordered me the N95s. You know what? I got them and then I wear them, but I forgot. I left it in the car, but I didn't want to have a mask on. I was going to a board meeting. But then I think it's kind of confusing as it relates to, is there really a difference in the effectiveness of masks?
There is. And keep in mind, this is something else that we have to remind people of. When you wear a mask, the mask is not for your own protection. Okay. The mask is for the protection of others around you. So when you wear a mask in front of, your mouth and nose, it has to both have to be covered. You can't have your nose sticking out, because then you might as well not have a mask on, right? But when you wear that mask, you are trying to prevent the spread of droplets, that are coming out of your nose and mouth to spread to everyone else. For the most part, any kind of, surgical mask that you might wear, or a mask that's not an N95 mask, is not going to, be protective against you sort of breathing out or breathing in other people's, droplets. But if everybody wears the mask, then you've prevented your droplets, they've prevented their droplets, we're protecting each other. The N95 mask is what we wear inside the hospital when we're going into a room, with a COVID patient, or we're going into a room with a, unknown patient. That protects the wearer of that mask, but a regular surgical mask does not. It does it offer some barrier? It is a barrier across your face, but if if there's air that can get in around it, then that's not the same thing. But what your goal is to prevent you from passing those droplets to those around you.
So the N95 is more or less twofold. You're giving it and you're getting it.
Correct.
And it's more capable of preventing you from getting it than the regular surgical mask. So
correct.
To the extent possible, when, if you want to rather be safe than sorry, then, all things considered, then
That's
one
true.
one should wear a N95
You
mask?
should wear whatever mask you have available to you. Now, if it's a cloth mask, the more layers, the better, right? So a cloth mask is going to give you the least amount of protection, especially if you can hold it up to the light and see light through it and that sort of thing. That's going to give you the least amount of protection. So the more layers a mask has to it, the more protection you're going to get, the more of a barrier it's going to be. But something, is better than nothing. And the
Right.
good thing is we at least have come far enough, down the road now that most places, even if you, like you said, you forgot your mask, you weren't, it's in the car, it's in you left it wherever. Most places nowadays that you go to will have a mask if you want one or need one. You'll walk in the door and they'll say, if you want one, here it is. So for a while there, you couldn't even get a mask. They were all sold out. But now we have plenty of masks, so there's no reason why people should not be able to obtain a mask. Now, lots of people don't want to wear them, but in terms of having access to masks, you should, there shouldn't be any problem with people getting a mask.
You talked about hospital population, as relation, who's in the hospital and why. So talk a little bit about who's in the hospital. Then also talk about one thing that I wonder about, and I hope you can remember all of these because I'm too old to remember everything after I say it. The other thing that I'm interested in would be the testing. It's kind of interesting, and I want you to editorialize on this. Why people line up to take a test more to the extent than they would line up to get vaccinated? I talked to Dr. Smith over at the Department of Public Health, and people are wrapped around the block, even out there at Top Dog got they doing testing and vaccination out there. A local doctor, Dr. Paula Harmon, she's been doing it for a while out there on Interstate Drive, testing and vaccination. And, they're all up Columbus Road, And it was not the same for the vaccination. So why do you think that is?
I think there's many reasons. I think people want to know, do they have it? They want to know. And then many people need to know, because if they're trying to go to work or go to school, if they have a sniffle or a cough or something, then their employer or their, wherever is going to say, well, you need to go get tested and I need to have a negative test. If you're traveling, which many of us are trying to do, then many places that you go want you to have a test before you leave or after you, come back and that sort of thing. So, I think there's lots of reasons. And then every time, you get a phone call saying, I'm calling to tell you that I tested positive and we were around each other a day or two ago, then the first thing people want to do is go get tested, whether they have symptoms or not. And that's not what you should do. So I think it's a lot of different reasons for why we're seeing, so many people need to get tested. But we're in the middle of a surge, right? So people are going to need to get tested.
Okay, on the test. Now, a lot of people got a problem. I'm not gonna call their name, but somebody close to me got a real problem with taking the test with the swab being inserted in their nose. Mm-hmm. Now, I want to know, do they do the other, like getting the saliva? Is that the only way to test for COVID, up your nose?
There is a saliva test, and I don't know a lot about the saliva test, but the nasal swabs are really, pretty much the standard that we, like to test off of. So that's really the best version of that test. Okay.
What about home testing? Have you heard? I understand you can't get the kit, but a lot of people are trying to, do the home testing. You got any research on that, on its effectiveness?
So what people should do, if you go to the CDC website or either the FDA website, or it might be on both, there are certain test kits that are approved, quote unquote, And we just need to people need to make sure that whichever one they're ordered, if they order them off of the internet or wherever they're getting them from, that they need to be on that list of approved test kits, because there are some test kits that are being marketed out there that are not the appropriate test. It's people trying to scam people and make, and make money.
I'm gonna cut
So
you off because we got to talk about kids. We don't want to do this show without talking about kids being tested and vaccinated.
sure. I mean, as of right now, every child age 5 and above is eligible to get vaccinated. So the recommendation is that they all should. I think if parents have questions, they definitely need to talk to their child's pediatrician about whether or not they should be vaccinated. Under the age of 5, those kids, are not eligible to be vaccinated. And so that means that the rest of us, the rest of society, needs to protect those little ones, because they can get it, they can become sick, they can spread it to others. So, but every kid age 5 and up is currently eligible and generally should be vaccinated, just like the adults.
Okay, is there a resource locally, a website or what have you, that a person can go to? I guess they should go to the CDC website
The
and get
CDC website.
educational information and testing information and mass information and what's effective and
Yeah,
what's
and the CDC website is good. People should not be intimidated. They have things for people that are written in very plain language. It's not all scientific stuff, so don't just think, oh, I probably won't understand it. They have really good information for all different levels of people that you should be able to understand, but the CDC should be your source of truth.
Has Atrium seen an uptick in hospitalization in the last few days or weeks?
We have. So that's why we're urging people to, again, get vaccinated, get boosted, wear your mask, and do the hand hygiene, all the same things that we've been saying. We recommend people to continue to do those things.
Okay, in closing, talk a little bit about the difference in unvaccinated and repeat that and breakthrough cases.
Sure. A case of someone that has never been vaccinated is, there's a risk that that person is going to have severe symptoms, need to be hospitalized, need to be in the ICU. In someone that's been vaccinated, that same risk is extremely small, almost zero, of having that severe type of illness. So you can still get it, even if you can still catch the virus, even if you're vaccinated. But if you do, then chances are you will have a very mild case, will not need to be hospitalized, and should get over it quicker, all of those things. So some of you may have heard of something called Flurona, and are wondering, is that a real thing or is that made up? What is Flurona? Flurona is exactly what it sounds like. It is when someone actually has the flu, and we have flu A and flu B, but either way, you have the flu and you have COVID-19 at the same time. It is possible to have what we call a co-infection, when you have two different infections at the same time. And in this case, if it's flu and coronavirus, then we call that Flurona. Depending on which lab you go to, many labs in the area will actually test you for what we call a respiratory panel. And so that means that even though they may have taken one swab or maybe two swabs, they're testing you for several different infections. And when they do that, they're able to, explain, okay, you don't have anything, or you have this, or you have this and this. And so we've been talking about the COVID-19 vaccine, but of course, we encourage everyone to get your flu vaccine as well, because we don't want you to have either of them, and we definitely don't want you to have them together at the same time.
Go ahead. I just started to mention it. We were going to talk about quarantine.
Yes, the other thing to mention is the CDC recently changed the recommendations about quarantine and isolation, depending on whether or not you've been exposed to someone with COVID-19, maybe someone in your household, versus you've been, personally infected with COVID-19. So let's talk about isolation, which is when you yourself test positive for COVID-19. If that happens, regardless of your vaccination status, whether you've been vaccinated or not, the CDC says you should stay home for 5 days. If you don't have any symptoms, or if your symptoms are getting better after 5 days, then you can leave your house. And when you leave your house, continue to wear your mask around other people for 5 more days. So that's regardless of your vaccination status. If you test positive for COVID, and symptoms specifically, I'm talking about fever. If you're still having fever, then you don't need to leave the house. Coughing. If your symptoms are getting better, then you can leave the house after 5 days. Now, let's say you were just exposed to someone. Somebody came over to your house, and then a day or two later, you get a phone call saying, hey, I've tested positive. In that case, then you need to quarantine, which is different than isolating. Isolating is just what it sounds like. You're not around anybody else, you're isolated. When you're quarantined, it's a little bit different. If you have been vaccinated and boosted, and you've been exposed to someone, then you can leave your house as normal, wear a mask for 10 days. And if it's possible, on day 5, get a test. If it's not possible, then don't worry about it. But if it's possible, get a test on day 5. And of course, if you develop symptoms at any time in that 5 or 10-day window, then you need to get tested and you need to stay home. Have been vaccinated but have not received your booster, then at that point, you probably want to stay home for 5 days. And then after that, continue to wear a mask around others for 5 days. If you can't do that, then you need to wear a mask for 10 days and still get tested on day 5. So booster versus not is the difference between you supposed to be staying at home versus not staying at home. So that should be another motivation for why you want to get, boosted. Or if it's not time for you to get your booster yet, if it hasn't been 6 months, then you should, fall into that category of, well, this is, I'm still in my initial window. Then you can act as you would if you had been boosted. So, but those new recommendations just came out probably last week towards the beginning of last week. And those are going to be really important so that we don't have to miss as much work or as much school, and we can make sure that we are able to do the things we need to do out in society.
This is a call to action. I'm your host, Alex C. Habersham, having interviewed Dr. Patrice Walker, a mainstay on this show as it relates to COVID-19 and what one should do in order to address it. I want to thank you again, Dr. Walker, for all that you do and all the important information that you provide to community. I want to encourage anybody to heed what Dr. Walker is saying about vaccination, breakthrough cases, wearing a mask, going to CDC website, because the purpose of this show is to educate and to motivate. This is a call to action. I'm your host, Alex Habersham, having interviewed Dr. Patrice Walker. Have a great day.
www.makingblackpages.com